What's going on, everyone? Today we're going to talk about how Medicare Advantage plans are squeezing the life out of care providers. It's not pretty. We're going to talk about it. But before we do, we got to make sure you like, comment, and subscribe to the channel. Show a little love before we get into this. Yeah, I'm just waiting for you guys. You're good. Yeah, whenever you're done, just type out a little comment. All right, cool. All right, good. My name is Chris Shannon, founder and CEO of Active Age Daytime Senior Care. So today we're talking about how Medicare Advantage plans are literally squeezing everything out of not just the providers, but also the people who are in need of care, patients, right? Over the last 5 years alone, the number of Medicare Advantage plans has increased by like nearly 10%, which like 42% of all people age 65 and up have chosen to use and go with a Medicare Advantage plan as opposed to the original Medicare fee-for-service plan. And the biggest difference between these two plans, just so you have an understanding, is that Medicare in the beginning used to be responsible for providing like services to those 65 and up, and you would provide a service, they'd pay a fee, and it was done by Medicare. Well, what happened is Medicare said, look, we're gonna give this like people the option, right? And so they're giving some of this risk over here to these insurance companies and allowing the insurance companies to manage how the money is being spent instead of doing the fee for service, right? They're now saying, okay, Humana, United Healthcare, whatever other insurance companies, you guys are the ones that got to handle everything and manage how the funds are being utilized and stuff like that, where the whole purpose of this was that the government was trying to offload some of that responsibility, some of that risk, and say, okay, well, these insurance companies can probably do this better. But here's what's happened. Here's the downside, okay? Is that while this is taking place, if you go ask any home health company, if you go ask, many of other providers in the space, and they come across a Medicare Advantage plan, they almost cringe. You can see it on their faces. And the hardest part is like you can tell that they're trying to play nice in the sandbox, but they really don't want to. Okay? And the reason why is because sometimes these plans are paying 40 to 60% less than what Medicare fee for service was paying. And so what it's ultimately doing is like, okay, yes, this is bad for providers, but at the end of the day, guess who's going to be affected? The patients, the people, the seniors that are in need of these services. Okay, look, when you first turn 65, you may not need a lot of this care, a lot of this help, right? At 65 years old, you might be pretty healthy. And so when this person comes in and sells you on a Medicare Advantage plan, you're all excited because that comes with all these benefits and it costs less. So it costs less and it comes with all these perks, all these benefits. You're like, this is amazing. But as soon as you need care, like actual care, like a physical human being coming to your house to provide physical or occupational therapy, maybe after you had a hip surgery or something, guess what? Like, you're just not going to get the care you could have on a Medicare fee-for-service plan. And so what happens is it creates this doom loop that people go into. And so they're squeezing the provider, that's affecting the patient. So you have, like, say, Bob, and Bob falls at home, and Bob goes to the hospital, and Bob gets discharged from the hospital, and he goes to maybe a skilled nursing facility, and their families are like, oh, look, Dad's going to get 100 days of care. And then on, like, the second week, they're like, oh, hey, Bob's got to go. His insurance won't pay for it anymore. And like, well, I thought we had 100 days. Well, you have up to 100 days, but the insurance company said like he maxed out and like this is all they can do, and like we're gonna be discharging him. I'm like, dude, Bob can't even walk. Like Bob was walking, now he can't walk. Like, how is he supposed to go home safely? This seems like a recipe for disaster. And then they're like, all right, well, we're sending him home, and we're gonna send him home with like a walker and these couple other things that can help him around the house, wheelchair, whatever. And send it with the orders, and then like you like. They basically try to set this up, and the case manager is like calling everyone, and like no one accepts this insurance, and maybe the Joe Blow down the street that does accept this insurance, like he's like he doesn't have those in stock, and now you can't get your durable medical equipment and supplies to go home and make sure Bob's taken care of safely. So now you end up going to Goodwill and getting stuff there because that's the only way to make it work because the insurance company won't pay for it. And then you get home and you're like, all right, we're gonna get Medicare home health in to take care of and do physical and occupational therapy at home. Well, maybe it used to be like 3 days a week or 4 days a week, or you get PT 3 days a week, OT 2 days a week, and almost every day you have someone there. Maybe that's how it works on fee for service, but not on a Medicare Advantage plan. All of a sudden, Bob gets 1 day a week Okay. Because that's all they're willing to pay. And it's all that the company can realistically do with the amount of money that they're getting compensated for to take care of Bob. So like, look, we can do 1 day a week. That's the best we can do. Well, Bob, he's not getting better getting like therapy 1 day a week. So guess what happens? He gets in the doom loop. And this is the doom loop that is continuing to happen more and more and more and more as we talk about value-based care. We talk about efficiencies of care models and all this stuff. Well, guess what? Bob needs extra therapy. Bob now is back in the hospital because he didn't have the appropriate level of care that he needed at home, but it had nothing to do with like the actual provider. It had everything to do with the insurance company because the insurance company had reduced reimbursement rates by 40-60%. So what do you think that's going to do? It's going to mean that Bob is not going to be able to get as many people and as frequent into the house because everything's going up. Cost of living is going up. Wages are going up. So if these companies are having to pay their therapy, their OT, their PT and stuff like that, and they're having to compensate and offset for that. But at the same time, the Medicare Advantage plans are reimbursing them 40-60% less than what they had been used to. This is just creating a recipe for disaster. And so what is going to happen? Well, we're going to see more and more people struggle, families struggle, thinking that their loved one is covered, that the insurance will take care of these services, these needs for these moments in time where your loved one has a fall or something happens. But you're going to see more and more and more that you can't just leave your dad at home now. You can't just trust the healthcare system to provide the services that dad needs to make sure that he doesn't have that fall again. And so it's going to cause families to reevaluate how they take care of their mom, their dad, or their spouse. And when they reevaluate this, they're going to be thinking what do we do during the times that we know we cannot be there for our loved one to ensure that they have the care they need during that time? And when is the majority of people going to need that? They're going to need it during the day while they're working, running errands, taking care of their own kids. They got kids of their own, right? So they're going to need that care during the day. And what is going to be the solution? I wonder what it could be. Adult day, baby. This is why I'm so pumped up about this, because at the end of the day, adult day is coming in as a solution to a need that is so important and so critical at this point in time, at this juncture, right? Because as these Medicare Advantage plans continue to bring on more and more people, right? Well, those people they're bringing on, they're getting older. And as they get older, they're going to need more care. And as they need more care, there's going to be less resources there. And the only company that's probably going to make the money is going to be the insurance company. And the providers are going to disappear because they can no longer afford to provide the level of care they need to stay in business. So providers are going to go away. There's going to be less options. The care that you might get just maybe much less than what you were anticipating. And so families are going to have to rely more heavily on their own resources to take care of their loved ones. And adult day is going to be the affordable alternative care option to a situation like this. And it's unfortunate. It really is. And I don't know what the solution is, to be honest with you, because every time I think they're coming out with a new solution, it's like a new marketing trick. But at the end of the day, you're still not getting the care or the things that you need. So it's going to be interesting to see where this thing plays out. But if there's one thing I can tell you for sure, adult day is going to play a huge role in solving this problem. And we are just the very beginning stages. So if you're interested in opening your very own adult day center, go to adcpro.com. Join us on our monthly webinars. Join us on our private Facebook group. Make sure you check out all of our videos on our YouTube channel. And if you're interested in learning more about our franchise model, go to activeagecare.com/franchise. I'll see you on the next one. Peace. Hey guys, thank you so much for joining me. If you'd like to learn how to open your own adult daycare center, go to adcpro.com. If you'd like the latest business tips, click here, and make sure you subscribe to our channel. Click here. We'll see you guys next time.